out to that have joined us. Just so you know, this webinar will be recorded. For those that can't join us live, they can watch it back later. So I'm joining you from beautiful Ghana country in South Australia, and I want to acknowledge this country that I'm on, but also encourage you to drop in the chat the lands in which you're joining on. And kia ora to some of our GPs who are joining us from New Zealand. It's great to have you with us as well. And very pleased to be joined by the two Chris's, Dr. Chris Davis and Chris Gimpel, for a conversation about smart recovery. How does it work in practice? How can GPs refer? And, you know, what is smart recovery? Because we know at the moment there is a pretty fair low awareness around smart recovery. So this won't be a webinar of a slideshow constantly. I just wanted to, you know, really give people a high level overview, and then we'll jump into the conversation. And please put into the chat any questions that you have. And thank you to those who sent some in advance. So what is smart recovery? We're a strength-based self-management mutual aid support. So a lot of people talk about group therapy. So people come to smart recovery for any problematic behaviour. Majority of our clients who come to Smart are for alcohol, but can be any behaviour, methamphetamine, gambling, and we use CBT and motivational interviewing to support people to achieve their goals. So for some people, their goal might be to reduce their behaviour. For others, it might be an abstinence goal as well. So we support people to set those goals and really give them the tools and skills and strategies they need to be able to change their behaviour. One question I get asked as CEO of Smart Recovery Australia is, well, what is addiction? How do you define addiction? And at Smart Recovery, we define it as behaviour. And we all have behaviours that we might want to change. But changing those behaviours, we actually need the tools to do it. We're research and evidence-based, so we have a research advisory committee here in Australia, and we also have a global research advisory committee. So we're actually in 31 countries. Smart Recovery started in the US. And we've also translated SMART into 13 different languages. And we have some culturally and linguistically diverse groups running here in Australia as well, which is great. People can come online like this. They can join an online meeting, or they can join face-to-face as well. So those meetings will run in community as well as in custody. So we have a number of meetings that actually run inside correctional centres and immigration detention centres as well. We have a range of different programs, family and friends supporting the support people who have a loved one that might be struggling. Inside Out is the program that runs inside correctional centres. We have our youth programs, and we also have Yarn Smart, which supports Aboriginal and Torres Strait Islander Australians, as well as LGBTIQ plus meetings. So in Australia, we partner with over 100 member organisations, and we've had a little bit of growth since we put the webinar together, which is fantastic. We now actually run over 400 smart recovery groups. And your patients can go onto our website, put in their postcode and find the meeting that they would like to join. There's no wait list, there's no cost, and they're able to get support. In terms of our program, we don't have steps, we have 4 points. So that's building and maintaining motivation. We absolutely always have to start there. What is the motivation for change? Learning to cope with urges and cravings, problem solving, and finding lifestyle balance. So we've developed a range of tools. And quite often at Smart, we talk about tool time in our meetings, which is where we actually step through those tools. And people do that in the group, but they can also download the tools from our website and do it one-on-one as well. And then in our Yarn Smart program, we have the 4 C's. We like fours at Smart Recovery. That is country, it is community, it is culture and connection. And I really love that quote. You know, what is the opposite of addiction? It's not always sobriety, it's connection. And that's a big part of our program. As I mentioned, predominantly alcohol is the behaviour we support, but we see people for food and internet shopping, phone addiction falls into that category as well, cannabis, methamphetamine, other drugs, sex and porn, and gambling. So generally in a SMART meeting, people are there for all different behaviours. So there might be someone there for alcohol, someone there for methamphetamine, someone there for gambling. But we also do have some meetings where the community it's just a gambling specific meeting, or it's just a porn addiction meeting. And that's come from the community that they want that closed group just to work with those behaviours. So they're the behaviours we support. In terms of who we see that come along to our meetings, as I said, we run 400, so we support about 4,000 people every week, predominantly men, average age 41 years. We do have women's only meetings that run, and we have men's only meetings that run as well as those LGBTIQ meetings. In terms of co-occurring mental health, about 66% of our clients will, actually be presenting with mental health concerns as well. So that's really what our clients look like. For those more familiar with a 12-step model, this is just a little bit of a difference between Smart Recovery and 12-step. 30% of our participants actually do both. And it's really important when we're talking to patients about, the power of choice and people finding what works for them. There's people in my life that wouldn't be here without 12 steps, and it's worked for them, and that's fantastic. For others, Smart Recovery works for them. So what's the difference between the two? Smart Recovery, we're all about self-empowerment, that cognitive behaviour approach, whereas 12-step has more of a disease model of addiction. We see addiction as a behaviour, and a behaviour that can change with the right tools. We very much focus on self-determination. So SMART actually stands for self-management and recovery training, whereas in 12-step, there's more of a focus on spirituality or surrendering to a higher power. We have a flexibility in attendance. Some people will attend SMART for a year, some for a few months. The research shows a therapeutic benefit is 10 sessions is recommended, but it's generally one meeting a week. Some people it's one a fortnight. We don't really have a lifelong attendance kind of philosophy, and it's goal-based. So abstinence might be your goal, but it might not be. Your goal might be just to reduce your behaviour, which is quite different to an AA or NA 12-step model. As I mentioned, we tend to support all addictions and behaviours as opposed to the 12-step model of focusing on one behaviour. So AA is for alcohol, GA is for gambling, NA is for narcotics. We have that 4-point program versus the 12 steps. And we very much focus on what's your plan for the next 7 days. So your patients attending a Smart Recovery meeting, we don't really talk about big, bold change. What can you do in the next 7 days to achieve your goals? And we want to give people those tools and resources to do that. So we very much focus on the here and now, and we don't have sponsors. So in the 12-step model, you have a sponsor that will work with you and support you on one-on-one. We have a trained facilitator. And whether you're a volunteer or a lived experience peer that has come through the program, you get the same training as an alcohol and drug counsellor does that runs Smart Recovery. So that's a really important part of our model. So that's just a very high-level overview to kind of ground what Smart Recovery is. And I'm really excited now to get into conversation with Dr. Chris Davis from Clean Slate Clinic and Chris Gimpel, or Chris G, as I will refer to as we go through the questions, who is a living experience facilitator and an alcohol behaviour change coach. So I'm going to throw to Chris G first. My question is, can you take us back to what life looked like for you before things changed?
Yeah, thanks, April. Hi, everyone. So some quick context for me. 42 going on 43 and based in Brisbane, Queensland, but did spend a bit of time down in New South Wales until a few years ago, and that's where a lot of the changes initially happened for me. Certainly not a new story in the broader society that COVID was a bit of a catalyst for my already pretty poor relationship with alcohol to really accelerate. And so that's where I found, especially working from home, being isolated and actually away from family and not too many friends as a network, I really sort of hooked to drinking more and became, physically dependent on that pattern. So Yeah, fortunately for me, I started making a change, and the GP network played a great role within it. Dr. Chris, who's here with us, he had started already by that time in Australia working with some people doing at-home detox and getting a bit of a treatment sort of option in that way. I knew about that option, but like a lot of people out there, didn't think I was that bad or that I didn't need help to change. Um, it took me a little bit longer to realize that I did need that. And it was a conversation with my GP at East Sydney Doctors in Darlinghurst just to say, look, I actually think this has gotten away from me. And I have known for some time there is this option. Can we talk more about it? And that's where I start. That's the clean slate at home detox model and support and recovery model. And what's really been a big factor in my success so far has been that smart recovery was enmeshed within that. So not only did I get clinical support when I needed it, but that was my first foray into working in groups. And like you've just touched on, April, I'm also of the same view that AA works for a lot of people, and I'm always very happy for people to go and attend those, and if it resonates, to keep doing so. But I do like the fact that with Smart, personally, I also found an alternative, one where I wasn't so focused on the label or the shame and stigma that I'd already been feeling, and felt a little bit more accepted as, look, this is something you can change. You've gotten yourself into a pattern. You can, of course, create new patterns. So that really resonated with me. Still took me quite a bit of courage to go into those first groups. I actually really like the fact that they're online because I could feel a little less nervous by being in my own surrounds, maybe even camera off to start with, perhaps, depending. I see that in a lot of meetings I go to now where people just have the space to ease into the situation a little bit more. So yeah, but before I was making some of those changes, I certainly needed something because I was up to about 20 standard drinks a day and had done that for at least 9 to 12 months. So my body was taking a bit of a hammering. And as I said, not only getting clinical support, but then community support and just realizing that, in fact, there was so many other people like me. It's just not something that's spoken about freely. And so once I was able to see that it was less a character flaw or not a character flaw with me, but more an external thing that I could change, that was a really big part in me making change.
And you mentioned there stigma, such a big barrier. Was there kind of stigma or preconceived ideas you had prior to going to a smart recovery meeting in terms of what you thought it might look like, or what was kind of holding you back? And how did that shift for you?
Oh, 100%. I think, like a lot of people, my exposure to group meeting settings had been in American movies and standing up, saying your name, and really sort of, I suppose, feeling perhaps the brunt or the overwhelm of whatever situation you may have found yourself in. So I was really scared about that. At the same time, I was also physically detoxing. So I also had that element at play. And like we know, a lot of people might first get into these groups when they're in perhaps a rehab setting as well. Not always, but that is part of it. So there's a lot of other things going on. Like there's a lot of other change going on. So I think I certainly had preconceived ideas that it was quite formal, structured, perhaps scary, and that I would be held to account for my actions is probably the best way I could describe it. And it was quite a nice relief to realize that, in fact, there's mostly just people there through good facilitation, like when they go through the training with Smart, we just learn to enable people to connect and realize they're not alone. And that just brings so many barriers down on its own.
Yeah, that feeling of other people have been where I'm at, and they've been able to get through and to be able to support each other and learn from each other. So powerful. I might go to Dr. Chris now. My first question for you, as a clinician, as a GP, how do you actually use smart recovery in practice?
Well, so I mean, I guess now every day through the Clean Slate program, we have smart recovery just built in to the 11-month support that occurs after someone's gone through a medicated detox. And it's become a real integral part of that resilience building journey once someone's gone through the sort of the medical procedure of a detox, I guess. But I started using smart recovery probably 15, 16 years ago when I was in the UK, when the options really that I saw were open to me before I really developed an interest in helping people with drug and alcohol issues, was either AA or inpatient detox. And AA never sat well with me. And again, I've had patients do fantastically well, and it's saved millions of lives over the years. And so I never like saying negative things about it, but it's called Alcoholics Anonymous. And that's just a word that makes me bristle, because the word alcoholic doesn't have any sort of medical definition, and is really a heavily stigmatized term. And it would certainly put me off. To know that I'd have to call myself that word, or would put me off. And it certainly, it was started in the early 1920s, 30s America, where everybody in America was religious, I think, and so it has God in the four steps, and which again puts some people off. Obviously, spirituality is a really important part of recovery, but everybody's gods are different, and you also it also I did never always felt safe recommending AA, but again, I've heard some stories about people being manipulated because it lacks that facilitation and that structure. I've been to a lot of AA meetings. I started a peer support group in one of my GP practices, which ultimately was followed an AA sort of format, although we didn't call it AA. So I met a lot of members of AA, fantastic people, really well-meaning, but sometimes the hour would be given over to one person. So the facilitation, the basis in cognitive behavioral therapy, the fact that it wasn't abstinence based, because again, I think that can really put people off. If people want help with their drinking, one of the barriers is that they don't want to be told that they can never drink again. And if you're walking into a room where people are going to tell you that will just stop you walking into that room in the first place. So smart recovery has always been my sort of go-to recovery module, if you like. And yeah, I'm a huge fan.
Again, that theme of stigma, it's so important, because we know that's actually the biggest barrier for people seeking help. And on average, it can take, depending on what research you look at, 10, 12, 18 years on average, because of that kind of fear of, being judged or having to commit to a huge change, like you say, walking into those rooms around, well, this is something I'm going to have to give up forever, and people aren't at a place that they're able to do that. Really keen to unpack a little bit now around the actual kind of detox, and what happens in practice if people aren't given that aftercare structured support they need after detox or after rehab.
Well, it's a really important point, because I still see it that people think that detox is the cure, or detox is even a treatment in itself. It's like I have referrals into the public hospital where I work saying patient needs a detox. And it's like, well, patient may need a detox as part of a structured long-term management plan, but the detox on its own is literally not going to be helpful if it doesn't have a discharge plan. And rates following an unsupported detox are as high as 85%. And often I'm pushing back when I get phone calls from the emergency department, and I'm on call as the addiction medic at St. Vincent's, and the ED doctor will be like, patients fallen over, they want a detox. And it's like, do they want a detox, or do they want to change their relationship with alcohol in the longer term? Because detoxing someone without that support is actually doing them more harm than good. Or potentially because of the kindling effect. We know the more times people go through a medicated detox, the riskier they become. So yeah, we push back because before we're planning a detox, before we even think of a detox, we're thinking about what support does this person need for them to meet their goals? What is the why? You know, why are they using alcohol? Is it because they have pain, unresolved trauma, an undiagnosed mental health condition? Is there stress at home, DV? You know, what purpose is alcohol serving? Because if we don't tackle why somebody is drinking, we can do a medicated detox, but if that reason is still there, we know these relapse rates are sort of inevitable. And I mean, that's where smart recovery is so good, because it not only has that community, the non-judgmental approach, that safe space, if I can use that term, but it also has a lot of psychoeducation that comes with it through the facilitation and through the CBT tools that Smart Recovery use, that helps people work out what that reason is and to break those patterns.
And that's really key, isn't it? In terms of, whether it's alcohol, whether it's gambling, or it's another drug, what's actually the behavior that's sitting underneath. And if we don't actually address that, then we're not going to get that behavior change. So I guess for the GPs that are listening at the moment who, may have a patient they're worried about, who isn't quite ready for inpatient, or what does the pathway of support look like? What can they practically do to support their patients?
Yeah, I mean, one thing that I've found interesting recently, and you talked about how long it takes for people to ask for help, and we know that only 1 in 5 people with alcohol use disorder ever ask for help. So it is the mental health condition with the lowest treatment rates in the world. And because drinking is so normal, and in fact, drunkenness is so normalized in our society, people aren't aware that alcohol is the cause of some of their problems sometimes. So we know 77%, and I looked at the numbers only this morning, 77% of Australians over the age of 14 drink alcohol. Of those, the people that drink, 1 in 3 are drinking at harmful levels. So more than the 10 standard drinks a week, which the NHMRC have deemed as lower risk. So 1 in 3 people are drinking at risky levels. That's about 6.5 million people in Australia. And of those 6.5 million people that we know are drinking at risky levels, 66% of them describe their own drinking as either social drinking or light drinking. So I think we have a role as a GP to start asking the question, to just do a 3-point screen. How often do you have a drink? How much do you drink? And then just reflect that back to somebody. And that's what I started doing 15 years ago when I gained the insight that I was drinking too much and it wasn't helping me. I started asking my patients about their drinking. And then I found that really the only options I had were to refer to AA or to the inpatient services, which didn't fit. Most of my patients describe themselves as social or light drinkers. They don't need to go into hospital. They definitely don't want to have a confession in a church hall and stand up and say they're an alcoholic. So how am I going to help my patients? So I did a brief intervention course. I learned about motivational interviewing. I found smart recovery. Um, and look, I started prescribing naltrexone, which we know can help people just reduce. I changed my whole language around how we dealt with these sort of unhelpful behaviors, and it made a massive difference to my practice because as we know, you know, the prevalence of alcohol use disorder and the harms of alcohol are huge, but the first step is to recognize them and have some evidence-based treatments to offer.
And it's asking those key questions, isn't it? And one of the resources we've developed is a destigmatizing conversations guide, because, the reality is that it is so stigmatized, even for us in the sector who are actively working against stigma. It comes up in conversations, and it's really important that we learn ways in which to, normalize the conversation and have it in a way where people are going to be likely to open up and share and actually reflect, as you say. If that 66% is, well, I'm just a social light drinker, how do you actually encourage that? Which is, a great thing about motivational interviewing. Keen to come back to you now, Chris G. In terms of, you mentioned the role that a GP played in your recovery journey, and that for you, I obviously know your story well. You were what people would kind of classify as high functioning, or, what do you think GPs often miss in terms of when, a patient like yourself comes in? How can they, to Dr. Chris's point, ask the questions or notice, what could have made a difference? I'm sure you saw lots of other GPs before the one that, played that critical role for you.
Yeah, thanks. So, I certainly empathise with GPs. I'm not of a clinical background, but I already, from my limited time working in some of this field, see how much GPs need to look for things and be on the lookout for various signs. And I realise the complexities that they would see and face, for sure. But some of the things we've talked about, I personally think are just more human behaviors that we can display. And I think people can pick up on that energy and they can feel safety. They can feel that there's perhaps no judgment, or there's an open space that's being created, even from the first greeting that we give someone, and making them realize that this is time that they're actually listening and invested in hearing about that person. And yeah, of course, we may not solve the challenge of people underreporting. I know I did. Every time I got asked for a number of drinks, I'd probably halve it and then take a few away and tell them that number. But by the same token, things we've just touched on already, I think are key, and that is, like, how would you describe your relationship with alcohol? Would have been a question that perhaps would have opened me up a little bit, or even, am I happy with my relationship where it is right now? Because everybody has a different definition of what they're happy with. And I think just working from some of those patient-led data points could be quite helpful, just to really gauge where that person might be sitting on their own scale with whatever behaviour that they're grappling with. And as I say, then I think it really is, people can really detect and feel if they're being heard and listened to and paid attention to, and that is the best environment, I think, for anyone to then open up. And I think the only other thing I'd add to that is not to underestimate the seeds that are planted in those conversations. And of course, you may never see that tree that grows, but I can assure you that that still stays on a particular patient's mind or client's mind, because they've been asked if they're happy with something, and it causes them to think, and it causes them to reassess and perhaps be a little bit more aware of their own behaviours in their own, as they go on. So even just consistently, asking people about where they sit on some of those scales, and if they're struggling, it's okay to have a challenge in a society like we've talked about, where it was often seen as, why can't you keep up, or or perhaps you're a little weak if you've got an issue with any of some of those behaviours. So yeah, I think those would be the things that I'd just reiterate are probably the most important for the people walking in the door.
So really in those first conversations, encouraging the self-reflection, really making sure that people feel safe and comfortable to be able to, yeah, just reflect a little bit more. Because as you say, there might be the halving of particular things or trying to, yeah, downplay what's actually happening for them.
Yeah, and I think just quickly to add, I think just reassuring what was important for me. I mean, I had got myself into a pretty um, uh, bad pattern, in my own words, or one that was not good for me, but it doesn't need to be a crisis to change. And I think we can also encourage people to have the breaks, to look at what could some smaller behavior change look like. Let's just experiment with a month or 2 or 3 without that behavior. How do you cope? What do you feel in your body? What kind of things are there that you can then zoom out and work on? And that's what I see Smart do so well is, funnily enough, of course, you take away what someone was using to cope generally or self-medicate with other underlying things, and they're then left with that underlying thing to navigate. So you've actually taken away the most common tool that person got used to, albeit it wasn't the best tool. So that's where the Smart model kicks straight into gear. And the other thing, as you guys were talking, that I'd like to paint the picture for those that haven't been in one, is the camaraderie that can build in those groups is extremely powerful. And the benefit, often going into those settings, I think for myself too, I actually just wanted some hope. You often come across people in the midst of big change or having some challenges, and they've lost hope. And in those forums, they can find people who can literally say, I was where you were 4 weeks ago, or I was there 3 months ago. And going on a regular basis just means you get to know these people and you get to give back to others too. So it's a real self-serving community as well, I find. And I think that's where I see so much power, is you can almost step away and people will help each other. And it's amazing what that can look like.
Some amazing points there. I just want to come back to an earlier one you made about like rock bottom, or yeah, the crisis, or actually getting in earlier and supporting people with that smaller behavior change is so important. And I think, that loss of hope, quite often, and I'm sure Dr. Chris, you've seen this, that recovery is hard and people are exhausted. Generally they will have been struggling for a long time. And, they really want support. They don't want more judgment. They don't want more stigma. And being able to see people who might be just that little bit ahead is so powerful. And also, I think, we hear a lot from participants who are 1 year, 2 years, 3 years ahead, to be able to look back and, really give back to the community. And I love that, when people have their own behavior under control, we say, at least 9 to 12 months, then they can actually become a facilitator themselves. And, our facilitators actually don't do a whole lot of talking. Their job is to really guide the group, and it comes, the power comes from the group. I actually got to go to Lisbon Addictions and see Dr. Tom Hoover from the US facilitate a Smart Recovery meeting, and he didn't say much at all. The power from the group. It was incredible facilitation. And I think, coming back to what you were saying, Dr. Chris, about, more of the 12-step model, that is very different to maybe one person who, has significant trauma and they're sharing their story, and that kind of dominates the meeting. So we really try and make sure that everybody checks in at the start of the meeting. We get to those practical tools to look underneath, what's actually going on in terms of behavior, and everybody sets that 7-day plan and really supports each other. I'm thinking now in terms of, like, if you have got a patient who's, come in for a GP, and they're really unsure of whether or not going to a group, whether attending a group like Smart is going to help them. I guess, Dr. Chris, from your perspective, how can GPs support that? If they've got someone who's, I guess we talk about motivation for change, and they might be in that pre-contemplative stage, not really sure. What role can GPs play in kind of supporting them to take that step?
Oh, well, I mean, the first step is knowing what Smart Recovery offers, of course. And we know if you actually take the patient to the website. So literally just get the website up on your computer and just show them the website, and show them how to navigate it, how to find a meeting. That actually makes a really big difference rather than just saying a name or even writing the name down. And it is about finding what that motivation is. And just sort of coming back to what Chris said before, I met a patient at St. Vincent's who was using crystal methamphetamine, who said that he had never ever met anybody who had been able to stop using. And he was only young, and he hung around with a lot of other people who were smoking crystal methamphetamine. But I just thought it was so insightful, because I'm like, that's what you need. You need to know. That's what you need to. You need to meet. And they've done quite a lot of studies in the power of the peer group. My husband, for example, would never take medical advice from me. He'd rather hear it from our plumber friend than he would from me. And it is one thing a doctor saying you should go to Smart, you should take this pill, but to hear from someone who's lived it and say, well, I've walked in your shoes, and this is what helped me. This is what helped me, and look at how it helped me. These are the people I asked for help. This is how I did it. It's so much more powerful than a GP saying, here, this might help you. So familiarize yourself with the website, know what it's about, work out what the patient's motivation is, the client's motivation is, and use the Smart tools, because that's exactly what they're there for.
That's great. And I guess I imagine, not being a GP myself, that, there's medically assisted support, there's, detox, there's rehab, there's so many different kind of options in terms of support. For a GP listening, I guess, where do you think Smart Recovery best kind of sits in, I guess, a model of care, and particularly if you're looking at a stepped care model, where is it best placed in terms of GPs thinking about how to support, and where Smart fits with the other supports that are there?
Yeah, it's a good question, and certainly at Clean Slate, where we will start with an assessment, which is what I would do as a GP. So start with a good clinical assessment, find out what your patient's needs are, what is the level of dependency, what are the comorbid mental and physical health conditions. So come up with a good treatment plan. If someone needs a withdrawal or a medicated withdrawal, that can be part of your plan. But again, as we said earlier, that needs to be taking those underlying reasons why into account. And usually it would be sort of after a withdrawal, or sort of some treatment for the use disorder or the behavior, that I would then introduce smart recovery. And again, it depends on the client's needs and level of use. Certainly, you can introduce smart recovery early if you like, and has periods where they're not using. You could slip in some smart recovery very early on. If someone's dependently using every day, then they're probably not in the right headspace to take part in a group. So I would certainly use it in that building resilience phase, which is how at Clean Slate we introduce it sort of post detox. Post withdrawal is where it fits into the Clean Slate program. But the assessment usually takes 3 weeks. The detox is 1 week. The recovery and support part is 11 months. So you can see how, how small a part detox actually takes in the management plan of somebody with a behavior or a use disorder.
And it's really important, isn't it, that people do know that there are options whilst they're waiting for other treatment, because quite often what we'll hear is there's wait lists and delays to get into, say, residential rehab. And so that's another thing that where SMART can play a role, almost like that wait list management of, well, at least go along to a meeting and get a little bit of peer support whilst you're waiting to access those other treatments, because we do know, across our country there are delays in terms of people accessing some of that other support. So I've certainly heard from a lot of participants that just kind of getting introduced to some of the tools and getting some of that peer support and knowing they're not alone before they then enter a rehab or go through, a detox is also useful. So that's something for GPs to bear in mind as well, that they can actually refer whilst they're waiting for other treatment. All right, I might jump back to you, Chris, and I guess if you wanted GPs to remember one thing from your story, what would that be? One kind of word of wisdom or advice.
Yeah, well, I was just a couple of things came up as you were talking there, and I think fortunately for me, yeah, as I touched on earlier, it's played a key role in me accepting that I had a challenge with alcohol at a period of time, and I'm sober now for a few years, and I put all of that down to SMART, clean slate, and some of the work I've done myself. But so the success is possible, but that came through many micro steps, and that came from many small sustainable actions, and a lot of those actions that I then became a facilitator in a peer fashion, and I still do it today. And I've done a couple of hundred meetings, I reckon now, and 90 to 95% of the time when people check out and say, what did they get from that meeting? One person at least, if not many, say, it's nice to just not be alone. That's the most common phrase to hear. And so I just, again, the CBT is extremely helpful. The patterns and the deep learning is extremely helpful. However, I also remember how fried my brain was when I was attending these meetings early on, and I actually have seen a lot of people who have just not known where to start with behaviour change and how to start. And I'd often say to them, just logging in or going in person to this meeting. And actually, we get so used to letting ourselves down when we've had a bad pattern and saying I'll change and not following through. So I see the power in saying you'll do something, and you do it for yourself, and that confidence rebuild that it can have. So I think it's important for GPs to remember that everyone will get something different out of it, and as we've touched on too, they could be in all sorts of sections of their journey or of the change or pattern that they're grappling with. Maybe just as useful for some people to see where they might end up in the challenges that they might face if they don't change earlier, or they might find that they really need some support and to lean on people. I think it can be any of the above. So I actually just think if the GPs are speaking with people, it is just keeping, as I said earlier, the humanistic approach and really just destigmatizing going to meetings and having groups and saying, look, it's just experiment with it. Go in and you'll actually find so many people are just like you, and you can't really lose how, you might go to a few, you might go to many, but the option is there. The key thing is that people need to know that the option is there. And so that's just getting the message out that there is this awesome opportunity to work on behaviour and work on it in group and in community.
Yeah, it's so important, isn't it, that GPs know about the options. And I mean, that's why we're doing this webinar. That's why we're having lots of conversations with GPs. And for some people listening, you may have met us at a conference, and because it is about the power of choice. But in order for people to have that power, they need to know about the choices. And, I think we need to do a better job of educating GPs and actually providing the different options so that, we can best support people on their journeys. I guess now to you, Dr. Chris, if you had, one last kind of hot tip or advice in terms of, GPs of what can really make a difference for them and their patients.
Can I have two hot tips?
Go for it.
I mean, look, the first one has to be to ask the question. Be curious. We're lucky as GPs that we can hang our hats on so many different symptoms. People will come and see us with anxiety, insomnia, depression, physical health issues, high blood pressure, which we can all attribute or can be made worse by alcohol and drug use. So have it always at the front and center in our mind, and make that, just by asking the question sort of helps make the space safer. My other sort of hot tip, something that I've got so much out of, is to go to a meeting. Like going to AA meeting or setting up those AA meetings was just such a massive eye opener to what incredible spaces those places are. And going to smart recovery meetings, not just has taught me how smart recovery works, and if you've been to a meeting, it's much easier to sell than if you haven't. But if you tell your patient you went to a meeting and you got something out of it as well, which you will, whether you like it or not, you will get something brilliant from that meeting that you'll take home with you yourself. But yeah, go to a meeting would be my second hot tip, and you won't regret it.
I love that, because it comes back to the point, because I've often had people, when I suggest come along to a meeting, they're like, yeah, but what would I talk about? And I'm like, well, do you have a behavior that you're doing too much of something? Because we all have behaviors where we're doing too much of something or not enough of something. And that's really part of that destigmatizing it, isn't it? Where, you can actually go along to a meeting and, share. It's really interesting. In a lot of smart meetings, people don't actually disclose what that behavior is, whether it's alcohol, methamphetamine. They're actually talking about what sits underneath. So we really would welcome GPs to come along, but actually participate and bring something. In our training that we run, you have to do a mock meeting at the end of the meeting, and it's really interesting. You have to bring a real behavior to work on. And a lot of people bring their phone, and they talk about phone addiction, because it's probably a bit safer. So for any GPs listening that want to attend, that's, one. But work, I mean, that's a big one. I was presenting at a conference today, and I shared, again, we all have behaviors, and for some people it might be work. So yeah, that's just another tip. But we do have some amazing resources that I'll quickly take people through, that you can actually access on our website. So we have a dedicated healthcare professionals page, and we've developed some really great tools, and you hopefully will be able to see it with my background. This one's around urges don't last forever. It's a bit of a sand timer, and it's got the QR code, and you can give this to your patients. But we do have a brochure for your clinics, the Destigmatizing Conversations Guide. You can go onto our website. We're going to drop the link in the chat, and you can download these. And we do have that identification guide, a bit of a checklist, as Dr. Chris was talking about, in terms of how to actually identify and ask those reflective questions. Of your patient. So you can download the digital toolkit, or you can order some physical kits that have the sand timer, as well as a coaster where there's a QR code on the back. And you can purchase these from our website, and we can get those delivered out. So, you've got some resources there. Just having some of the pamphlets, in your waiting room, so that people can actually see and pick it up and have a little bit of a look and get introduced to smart recovery, because chances are it's not something that they've heard about. So it's really important that we give them their resources. So thank you so much to Dr. Chris and Chris G for joining us for this conversation, to really make sure that healthcare professionals and GPs have the resources they need to best support their patients. So thank you everyone for joining us.